Hi, this is Dr. Kajiki. I am the owner and director of the Valley Thyroid Institute, located in Tarzana, California. We do worldwide consulting. We work with patients all across the United States, all across the world, Canada, UK, Germany, France, England, Asia, Australia, New Zealand. We've got patients all over the world, so there's no geographical boundaries how we can help people. Now, what I wanted to talk to you about today is a very common scenario that I get. Patients send me lab test results for evaluation, and a very common complaint is they're saying to me, my doctor says my lab tests are normal, but I still feel lousy. Now, I'm going to tell you that there's no way that can happen. If your lab tests are normal, whether you're taking medication or not taking medication, there's no way that your lab tests can be normal and you still feel lousy. Okay? So the doctors are either reading them wrong, doing the wrong tests, or not doing enough of them. Most likely it's all three of them. So one thing you have to keep in mind is this, is if you go to your traditional medical doctor, you have to understand that your choices for treatment are medication, radiation, and surgery. That is it. You have no other choices for treatment. So in that traditional medical world where they are influenced by the pharmaceuticals and the insurance companies, your only choices for treatment are medication, radiation, and surgery. Now, if you go outside of that type of medical model to the alternative healthcare, the integrative healthcare, functional medicine, natural medicine, holistic, now your choices are very, very wide. Now, if you go to a functional medicine specialist like myself, my choices at that point are I can give you vitamins, minerals, enzymes, amino acids, detoxes, de-inflammatory eating protocols, whatever it takes to normalize your thyroid test results as well as get you feeling good. Now, in my world of functional medicine, I care more about how you feel and secondarily how your tests look. So I want to get you feeling good first and then match your lab test results to how you feel. Now, the biggest problem with lab test results in the traditional medicine world is this. They will typically only do 3 tests. They'll do TSH, free T4, and maybe if you beg them, they'll do free T3. And the reason is because their only choices are medication, radiation, surgery. So there's no need to do any other testing. Okay? Unfortunately, that's the way it works in that kind of model. Now, in the other healthcare model, the holistic model with functional medicine, we can do any test that we want. Okay? Because we're not influenced by the insurance companies and the pharmaceutical companies. So I typically run a panel of 10 thyroid tests. And if you look at this panel here, you'll see on the left side here, these are the 10 thyroid tests that I run. I run all these different tests here. Okay? And you could see by this person's panel here, there's no abnormalities. This person has all normal thyroid tests, but she still has thyroid symptoms. So I evaluate it differently. I evaluate it in a functional lab manner. To the right is my functional analysis, and you'll see that my ranges are a little bit different. It's because we use more narrow ranges and we get functional lab range. So I want to know functionally what's going on, not necessarily if there's any disease process, although we do look at that as well. And you'll see on the right side how I mark them off in a functional manner. There's many abnormal tests that are indicated in yellow, where they would have completely missed them on the other panel. Even if they did all 10 tests, they would have missed these abnormal tests. So number one is the typical medical doctor, medical practitioner, or traditional medicine doctor only does TSH, free T4, and maybe T3. I do all 10 of these tests. And all 10 of these tests are important because they all have different functions. Okay, the TSH tells us how well the pituitary gland is talking to the thyroid gland. The T4, total T4, tells us how much T4 is made. The T3 uptake tells us about the thyroid hormone taxicabs, the taxicabs that have to take the thyroid hormone from when they're made to the different parts of the body. Okay, the free thyroxine index is more of a calculation. It's not really that valuable to us. The total T3 tells us how much total active thyroid hormone is created. Okay? The free T3 tells us how much usable active thyroid hormone there is. The reverse T3 tells us if there's any stresses involved that are blocking the thyroid hormone from getting into the thyroid receptor site, which means you can be making all the proper thyroid hormone, but if it can't get into the receptor site, you still have feelings of hypothyroid even though you may not have hypothyroid. The T4 tells us how much of the usable inactive thyroid hormone that is produced, and that T4 has to get converted to T3, and that typically occurs in the liver and in the gastrointestinal tract. So if you have any detoxification issues or some gut issues, that will block that conversion of T4 to T3. And then the TPO antibodies and the thyroid globulin antibodies tell us if you have Hashimoto's. Now, if you have Hashimoto's, this whole thing changes because now we realize you have an immune system problem more than a thyroid problem. And 90% of all the hypothyroid problems are Hashimoto's in nature. And which means that these people are getting thyroid medication to treat an immune system problem. So you could see it's very different, the tests that we do and the way we evaluate these tests. And hopefully I've given you enough information here that you can make a better decision on the next step towards regaining your health.